Okay, well, you're all holding your concentration really well. I'm sure you've all been at work most of the day as well. So I'll try to make this interesting, and I realise that spirituality actually is one of those topics. It's probably more taboo or equally as taboo as sexuality. So why would we want to think about it when we're talking about cancer patients and cancer survivors? Well, it turns out that the literature shows that the patients would like us to. They would like their healthcare professionals to broach the topic. I don't know if any of you ever do that. The stats from the US, fairly recent, 2006 survey, showed that 60% of cancer patients would like their doctor to talk about spirituality or maybe religiosity, because we can put the two in the same basket, but not everybody who identifies themselves as spiritual also identifies themselves as religious. But 10% have actually talked about it with their GP. So that's the why. Spirituality is an unmet need in cancer care. So self-care isn't the same thing, and in fact a lot of the topics tonight have covered self-care. The exercise, the nutrition, the intimacy, the connection with other people. But self-care can also be about your internal life. And so in this sense, there are some interventions where we can create a greater connection with ourselves. And cancer does push those buttons for people. It's really easy when life's going well to just do all the external stuff, be busy, be happy, have fun with people. But when your mortality is called into question, that starts to raise some questions. And a lot of people either return to a faith that they were brought up with, or they seek some new and different way to connect with something greater than themselves. Just like sexuality, spirituality is incredibly diverse. And it would not be right, it wouldn't be appropriate for healthcare professionals to broach a subject that wasn't inclusive. And so it's difficult to talk about because we all come from where we come from, we have our own beliefs. And so how do we talk about this with people in a way that doesn't exclude, that doesn't judge, that isn't proselytising or trying to sell anything to anybody? Well, maybe we can start with defining the subject. Some of you might have seen the fabulous TED Talk by Brené Brown. She talks on TED Talks about vulnerability, and she herself is a beautiful example of how warm and appealing vulnerability is. So she defines spirituality as recognising and celebrating that we're all inextricably connected to each other by a power greater than all of us, and that our connection to that power and to one another is grounded in love and compassion. Practicing spirituality brings a sense of perspective, meaning and purpose to our lives. And so there is a growing body of literature that is assessing spirituality. And these are some of the subtopics that are being pulled out, the threads that are being pulled out. Finding meaning, finding purpose, sense of connection, sense of transcendence. In October, I think it is, we have another wonderful visitor to Perth, Christina Puchalski, and she is a spirituality and cancer expert, a researcher who's been very, very widely published. She's the director of the George Washington Institute for Spirituality and Health in Washington, DC, and a professor of medicine at George Washington University. She's part of this growing body of researchers looking for culturally appropriate ways to build the spiritual dimension into healthcare without alienating, excluding or proselytising. In a 2009 article published in the Journal of Palliative Care, Puchalski and her colleagues did a literature review, and they indicated that spirituality is definitely a patient need, that spirituality affects healthcare decision making, and that it affects healthcare outcomes, including quality of life. There's another good definition here from Pargament, another of the big authors in this field, who defines spirituality as a search for the sacred, a process through which people seek to discover, hold on to, and when necessary, transform whatever they hold sacred in their lives. So some of these authors and many others have been developing tools for measurement. One that I've used in my master's research is the Facet SP, and there are particular questionnaires for cancer patients to measure spirituality. A number of these instruments make a link between spirituality and health outcomes. So the evidence is actually starting to build up and become fairly compelling that spiritual life does impact health and wellness and survival as well. One of the largest studies involved 126,000 participants, and the findings indicated that people who scored highly on measures of religiosity had 29% higher odds of survival than those who scored lower. Now, a lot of the research from the States focuses on religion and church attendance and prayer, but there's also a growing body of evidence that is more secular. And so that brings us to some of the kinds of interventions that are available. Oops, I skipped the positive health psychology. I'll jump back to that because that's quite important too. So the history of positive psychology, just a little capsule. Psychology has always focused on the detriments, has focused on disease, fitting people into categories of what their disease diagnosis might be. But in recent times, the last couple of decades, there's been a movement towards what constitutes well people. What is it that happy people are doing? What are people who have successful relationships doing compared with studying the people that don't? The people who have good mental health and are high functioning, what is it about them and their choices and their attitudes that helps them be so well? So one of the leaders in that field of positive psychology is Martin Seligman, and he links the positive psychology movement with health, and he calls it positive health psychology. So it's not exactly placebo effect, but maybe it's similar. And I agree with what David Joske said entirely, that it doesn't actually matter why it works. And that the mechanism is difficult to pin down, obviously. But patients with faith seem to have an optimistic explanatory style. They put the events of their life into the context of some force greater than themselves. Now, whether you agree or disagree, it doesn't matter if it works for the individual. And many people do find that this helps them to hand over the reins. So there's empowerment through doing certain actions and activities, but then at some point there's acceptance, there's letting go, there's surrender, and trusting that something else is happening here, that this is how things are meant to be. So maybe it follows that any form of spiritual belief can provide this positive approach if the person has internalised their faith. Okay, so now we come to the evidence-based spiritual interventions. Now, what's nice about yoga is that it doesn't have to be spiritual. We could equally put yoga in the exercise as medicine category. It is a physical practice, particularly the way yoga is taught in the Western world. It's very much focused on doing postures. And there is a lot of evidence to support the findings for physical benefit. There's also a lot of evidence for the psychological benefits, and there's just a little bit of evidence coming through now that there is also this spiritual component that increases people's sense of spiritual well-being. So the Cancer Council offers yoga, not under any banner of spirituality, but under a complementary therapy that people may choose. People may self-select to participate in these free yoga classes that happen around the metro area and country areas as well. The Life Now programs also include meditation, particularly mindfulness-based practices, which again are very much secular. They're not coming from one particular faith, although one of the leaders in the field, Jon Kabat-Zinn, does have a Zen background. So this is now being measured all over the place. So there's an image, that's a real Life Now yoga class from a couple of years ago, and I've been teaching these Life Now yoga classes for about 5 years. Now, although we say they're gentle, the participants can push themselves quite hard if they choose to. The posture they're doing there is downward dog, and although that in itself is a fairly static posture, moving in and out of that posture probably constitutes resistance exercise. It's a pity Daniel's gone, but I think that it probably does. So they're moderate to gentle, depending on people's stage of treatment, and people are actively involved during treatment as well as post-treatment, and anyone that's been affected by cancer can attend. And the meditation courses also, based on the work of Jon Kabat-Zinn, are currently being evaluated by UWA academics led by Kelly Bennett. So meditation has been studied since the 60s. You might have heard of Herbert Benson. He coined the term the relaxation response, And he came up with that based on his study of transcendental meditators. So what are these meditation and yoga practitioners? Because yoga is in a way the same. They're almost the same, except one is moving the body and one is keeping the body still, but they both utilise this mindful moment-to-moment awareness. So that's one definition of mindfulness: moment-to-moment, non-judging awareness. Just being with what is. It's an incredibly powerful, very simple technique. So the Harvard School of Medicine, Herbert Benson, when he was a cardiologist at the Harvard School of Medicine, saw in these meditation practitioners decreased heart rate, decreased respiratory rate and slower brain waves. Since his original observations, the practice has been found beneficial for chronic pain, insomnia, anxiety, depression, and it's widely considered a useful adjunct to treatment for patients with cancer. So all of those integrative oncology centres that David Josky mentioned around the world utilise yoga and meditation as complementary therapy interventions. Now, I know I'm running out of time. I'm going to finish up now by letting you all know also about something that we at the Cancer Council would really love your support on, which is the education programs that we are about to launch. They're starting in August. We've got 2 streams of education seminars for patients. One for people who are newly diagnosed and currently undergoing treatment, and one for those who have finished treatment and have come to that kind of what now question. So we hope that people will live well during treatment. All of those dietary and exercise recommendations that you've heard tonight will be covered in the patient education seminars for the public to come along to whatever they're interested in. And we hope that they will not just bounce back after their cancer, but bounce forward into a bright future. Thank you.